According to the Chartered Society of Physiotherapy, physiotherapists are people who help those affected by injury, illness, or disability through movement and exercise, manual therapy, education, and advice. They maintain health for people of all ages, helping patients to manage pain and prevent diseases. Good afternoon to you and welcome to the What's Poppin' Show. I'm your favorite ninja race, Carolina Calls, and today we are popping to none other than Polycare Wellness Center situated at Lavington Mall. And guys, if you have any question to do with physiotherapy, chiropractic, reflexology, feel free to ask because I'll be asking the right people or rather the experts. So we are the reception and hi, how are you? I'm Carolina. What's your name?
My name is Stella.
Stella.
Yeah.
Awesome. So Stella, we are here to see Albert. Yes. And we're so excited because we don't know exactly what he has on offer for us. Right. What do you think he has planned for us?
Well, I'm sure he's going to explain all about physiotherapy, and the doctor is also on standby to explain about chiropractic treatment and how it affects the general health of any human being.
Awesome. And we even have a doctor. My God. So where is Albert?
Please have a seat.
Oh, okay.
I'm going to ask him to come and get you from the reception.
Amazing. Aya guys, if you have any question to do with physiotherapy, please just post them below because I'll be asking. In the meantime, questions I have planned for the doctor are the benefits of visiting a physiotherapy center. What's the difference between a physiotherapist and a chiropractor? Oh, Albert is here already. Hi Albert, how are you doing?
Fine.
I don't remember my mic on one side. Hi.
Welcome. So this is Polycare Wellness. You're welcome. This is a physiotherapy and a chiropractic place. So please, you're welcome.
We are so welcome.
Yes.
Where do we start?
Please.
Okay. Oh, sorry. And you're wearing like a nurse.
Not really. You know, sometimes this gives an illusion of cleanliness. It's a good place and it has to be very hygienic. So let's feel free and you're welcome here again. Yes.
Okay. So what do you have here? I see you have so many different rooms and all that. So kindly first introduce to us what Polycare Wellness Center, what do you guys deal in?
Of course, again, it deals with physiotherapy and chiropractic. That is our mainstream treatment. We also have massage and several treatments that we do here. So I'm going to take you around, show you the rooms and what we do exactly. Okay?
Amazing. We are so ready for it. But first, let me ask you, what do you think will be the benefit of one visiting a physiotherapy center?
There are very many benefits for visiting a physiotherapy center because you find that now with physical therapy, we help to alleviate problems. Let's say if you're having neck and back problems, we help with modalities to relax the body, to help you get a bit better in terms of your posture, how you stand, how you sit. So it's very, very broad depending on one's problem or condition. Yes.
So can one say they won't probably take any medicines and they start physical therapy just?
Yes, of course. Yes, of course. You find that, let's say, when you're in a lot of pain, physical therapy helps to relieve that pain, therefore reducing your chances of you taking medications. But also, depending on the amount of pain that one has, we can combine physical therapy with some medications for better progress in terms of less pain and to make you live your life better. Because with pain, you find that when you're in pain, you have a lot of discomfort. This one helps you to become a better person and to live well. Yes.
So you've only spoken about pain that comes with injury.
Yes, of course.
What do you think are what are other type of therapies that you guys offer?
We have massage therapy because you find sometimes people come here with muscular problems, people who work hard or train hard, or even sometimes people who sit in the offices. You find that they have a lot of pain. So we really help with relieving that pain with the massage. The massage therapist knows on how to work on those particular trigger points and stretches to help one relieve that pain and to relieve that tension. Yeah.
I said there's some activity kind of going on there. Yes. All right, so we go to another room. There's a massage room. My God. All right, guys, this is how it looks.
So this is the...
Where have we kept it a bit dark?
So that at least we can create that illusion of relaxation where someone will not be thinking a lot when they're coming for this massage. So you find that in this room, when you come, you're at peace. You don't have any pressure from anything or anyone. So it helps you to really concentrate or relax, feel good about yourself, rather than having a place that has a lot of noise and distraction. Because when you go for a massage, you want to just lie and relax and enjoy the session.
So any all types of massages?
We have several types of massages. We have those Swedish massage, tension tamers. There are very many, though I'm not the massage therapist. The massage therapist is in a better position talking about that. Yes.
So probably can go to the other one. Alafu, what's the difference between a physiotherapist and a chiropractor?
I will explain about physiotherapy. Physiotherapy is a branch of science that deals with treatment of ailment via modalities and things like heat, electricity, just to help someone feel a bit better in terms of their condition or their problem. But with chiropractic is an alternative form of medicine that helps with dealing with spinal problems. If you have any problems with your spine from the neck or joints, realignment for subluxed joints or dislocated joints, the chiropractors work on those particular spots to make someone feel a bit better. Yes. So that's the major difference between the chiropractor and a physiotherapist, though we have Dr. Stoa, who is a chiropractor. She can really expound on that, on chiropractic, yes.
Before then, let me big up Abdus, I can see you, Marima Mangi, Mike Agre, Muiretu Muradhime. Thank you so much. And if you have any question, feel free to ask. MC2, you're asking, sasa utakuwa ukienda clinic huko. No, it depends on what they have to offer. Yeah, so feel free to ask any questions. Otherwise, let's meet Dr. Margaret. How are you doing?
I'm fine. How are you doing, Carol? Yeah? Yeah?
Excellent. You can probably say hi to guys and probably introduce yourself.
Hi, I'm Dr. Margaret Stoa. I'm a chiropractor, one of the 10 chiropractors we have in this country. So only 10 of us. Chiropractic is a new age kind of treatment for ailments of the body. Yes.
So what do you have for us today?
Well, today we're going to look at the spine because chiropractic comes from the premise that the body has the ability to heal itself without drugs, without medication, without surgery. And most of the time we find that most people who come to us have neck pain, back pain, shoulder pain, knee pain, and all they need is a little manipulation because we are trained to analyze the spine and manipulate and reset it, realign the spine. So I'll just take you through the vertebral column because we have the spine over there.
So guys, when you're going to biology class like me, we did a physics. Hey, okay, so we imagine this is the spine.
This is a spine. This is a vertebral body. Everybody has a spine in the middle of their bodies. So it's really the skeleton. It forms a framework of your skeleton. So you have the skull, this is a skull, and then you have 24 vertebrae, right from the first to the tailbone here. They're all stacked up on top of each other like a ton of bricks, and in between is a disc. And most of the time, because of the things we do, we tend to get a disc a little bit protruding out of the center of the spine. And that's when we have impingement, what we call impingement on the nerves. These are the nervous body. These are the nerves that come from the spinal cord. So the function of the vertebral body is really to protect the spinal cord. And from the spinal cord comes nerves that go all over the body. It's like an electric cord, from the center, from the brain, right through to the body, and the nerves come out like electricity, electrical cords. And sometimes it could be impingement, meaning it's pressed, and then you start feeling pain, you start having tension there, and all we need is a chiropractor to analyze which area of the spine is compressed, and then you can actually adjust it. So this is where we're coming from.
So I hear guys with probably asthma can probably heal from all this.
It's good you talked about asthma because all the organs of the body are supplied by a vertebral nerve. So asthma, it could be compression between the 7th and the 6th thoracic vertebra. That's where the origin of the vagus nerve, what we call a vagus nerve. Vagus nerve goes and supplies the organs and the chest area. So there could be an impingement there. And just by adjusting it, you can breathe better and you can cope with your asthma. Actually, the premise of a chiropractic is to create health in the body. So we just make sure that the body can be able to cope with things that are, compounding us, like the environment. So by opening up the nervous system, you can actually heal better. Mm-hmm.
Awesome. So guys, Lorna Joseph, I can see you. Grace Okot, Obo Eke, how are you? Michael Alex, how are you doing? Abdul Rehman, you're asking, my wife has a problem in the spine. Her nerve is pressed. Can you help? And where are you guys located?
That's a good question, because if she has a problem in the spine, her nerve is pressed, did she say she has back pain? Yeah?
He has just said my wife has a problem in the spine. Her nerve is pressed. Just that. And the location.
Okay, all right. We can help. The location of a clinic or the location of?
Yeah, Polycare.
Polycare is located in Lavington Green Shopping Mall, and we have another center in Kigiri area on Getcha Road. Yeah, we could definitely help. Yeah. Uh-huh.
Hata naona pia Muradhime pia ameuliza the same question about the location. So guys, we are at Lavington Greens, but otherwise, if you have any ailment, probably you can ask whether they can be able to heal it, because here they have a lot can happen. Actually, me I know about physiotherapists from my brother does these things. He was born with cerebral palsy, so they kind of do those kind of massages, and you need to straighten the legs. Yes. So that's where our physiotherapy comes in. Yes. So probably can expand on that.
Yes, that's true. Physiotherapy and chiropractic are kind of a little bit interrelated. That's why when we have one center that has the two therapists in one location, you're better off than just going for an isolated one. Yeah, cerebral palsy, children have a problem to cope with their mobility, and they will need physical therapy to help with that, where they will need some exercises, some rehab, and some what we call just functional stuff that they can work with so that they can get better. But chiropractors will actually analyze that spine to see if there's a location, because really everybody has a spine. So no matter where you're coming from, even the baby bump can actually get analyzed if she has back pain. So don't fear if you're pregnant and you need to have your spine looked at. You can get adjusted. And one of the things about chiropractic is we don't have to have pain in order to come in. Yeah? You need to be analyzed. You need to check your spine and just say, okay, let me go for a spinal check. Maybe let me see what's going on with myself. Because sometimes you might find there's an issue that you can deal with without it becoming chronic, without it raising it on an issue. So if you can adjust the spine, then there's no more impingement, and then you can move better. Highly sporty people need to come in as well, because of the way they tumble. They're all doing high impact sports, so they need to come in for an adjustment because something will pull in a certain area. Yeah.
Okay, you're making it you're making it sound so easy. It's just like you're just fixing your spine and everything is gonna be okay. It's so easy, right?
Yes, it's very easy. It's nothing so complicated. It's very easy. We analyze the spine. We look at the mobility in the vertebra. And one of the things that we use is basically just what we call palpation. We are taught how to feel the tension in the tissues and be able to locate that. Another thing that can help is x-rays. If you have a real chronic problem that has been going on for a long time, we'll probably advise, go in and get an x-ray. Let's see how your structure looks like. It's only by visualizing it, that's when you can say, okay, there's something going on here, yeah? Another thing is just your symptoms and the way you walk. Sometimes you find people walking like a crab, they're walking funny, and one of your pelvis might be off. The pelvis is this hip bones this way. And sometimes you find that a shoe wears off one side just because there's no balance in the body. So it's really important for someone to come in once in a year, saying every frequently, and get yourself checked up, yeah? Just get a checkup. We tend to look at our machines. If you're driving, you'll take your car for a service, but you don't take your body in for a checkup. Yeah, so this is where the premise of chiropractic comes in.
Nice. And I can see you have a patient.
Yes. You have a patient.
Maybe she can tell us why she chose to come here and what she's feeling and blah, blah, blah.
Mm-hmm.
Okay, for me, I have an old injury, let's say. So I want to see if they can help me with my old injury that causes a lot of pain in one arm.
Okay, what happened?
So I broke my arm and dislocated my shoulder. But because of where the arm had broken, they couldn't snap the shoulder back. They had to wait for the broken bone to heal first. So when it healed, I never went back to get my shoulder realigned.
Can you help with that?
Yeah, we can help with that. One of the things about the body is it's all interconnected. The shoulder is connected to the neck through this shoulder girdle here, yeah. And what I'll do is actually analyze, see how her motion is, where there's any restriction, and then I just apply a little force. So I'm going to look at her neck first, and then I'll check her shoulder.
Okay, sure.
Okay. Just remove your shoulder. Just stop. That's good. Excellent.
Okay, so Team Mafisi.
It's really easy. It's really soft. Okay, I want you to look up to the ceiling. First of all, we're looking at motion in the neck and then into your chin. And this is pretty good. I want you to go center and look over your right shoulder. That's it. And then center over the left shoulder. That's it. Even just by looking her, she has more motion on the left than the right side. I want you to drop your right ear towards your shoulder. It doesn't have to drop there. And then up. And then the other side. And up. Okay. Because you mentioned the right shoulder, we're going to lift up your arm. Just go up, 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 up. Very good and easy. And all this time I'm feeling how her motion is going in the shoulder. And then the left side, and every time you compare, I'd like you to touch the opposite shoulder from behind. That's good. Yeah, that's good. And then down. Okay. And then down. Okay. The other side. Now from behind, touch the opposite shoulder. That's it. Yeah, and then down, all right? And again, we compare it. How about your left side? Touch that side. That's it, okay? And then the opposite shoulder. That's it. And you can see this one really goes higher, and the other one was a little bit lower. So I'll probably just motion it. I want you to be quiet. I want you to touch your shoulder and just relax there. And all you need to do is take a deep breath in. And out. Right, little force there. All right? That's it. Okay, and we'll just check that. Another thing that I tend to work on is look at her leg lengths to see whether there's anything going on in the spine. So my dear, if you could just lie on your back, face down, your head is going to be here. On your back, on your back. So on your back, yeah, that's it. All right, tend to look at that, look at her legs, look at her leg lengths. Yeah, that's pretty good. That's pretty good. All right, okay. I want you to bend this knee, bring it over to your chest. Any pain anywhere? No, good. And she has very good range of motion. Lift up the leg, knee straight. Yeah, that's where we get a little bit of tightness here. And I'll probably say, okay, you'll have to see your physio and do some stretch exercises on the back of the leg. Because, maybe you're not stretching enough, right? Bend this knee, bring it over to your chest. That's it. And straighten. And lift up with the knee straight. That's pretty good. And actually, you can see hers goes a little bit further here. So it's always about comparing your right and your left side. All right? Cool. You're going to have you turn, lie on your back. All right? Excuse me. Let me get the pillow out. And hands, head here. That's it. I'm going to get this here so you can place your hands right down. Your face is down. Okay, you're looking at her leg.
So we'll have faces down. Okay, guys, if you feel free to ask any question.
I'm going to drop this ever so slightly so that you can be a lot even. Yep, that's good. And we're going to look at her leg lengths again. You must make sure that you're looking at the spine and making sure that she's when she bends up, that one draws up a little bit longer than the other. The perfect scenario is to have them kind of even. But you see that? And when we bend it into a knee, it draws up. That's it. And we go rotation, just relax. That's it. Okay. And next I'll actually look at her pelvis and see. Just going to palpate your pelvis, yeah? Your back here and then there. I actually feel a little bit of tightness in there. Is this painful? No? Not that much, yeah. Sometimes actually you don't have to feel pain, but you can see And actually, if you compare her right side and her left side, a bit more. Okay. I'm going to give you one adjustment right here. And all you need to do is take a deep breath in and out.
Is it going to be painful?
No. Was that?
Is it painful?
Take a deep breath in again. Out. Just relax. And then I'll check her neck area, because as I said, shoulders and necks, and you can actually feel a tightness in the right side. Is this painful? A little bit on there. Just palpating her vertebrae. Remember, I said there are several vertebrae running from the tip of your skull to the neck, and these ones are 7 of them stacked up. For the neck area, we have 7 stacked up on each other. And if you can just look at this model here, you'll see them. Excuse me a minute.
Okay. So guys, we're being taken to a class.
If you want to see, it's this particular one. You want to sit up and see? So these are the neck vertebrae. We have the back of the skull, and then we have the atlas. The atlas is like holding up our head, right? Yeah? So the atlas is always under a lot of tension. And then you have 1, 2, there is 1, 2, 3, 4, 5, 6, 7 of them. And for you, yours is rotating over to the right side. So what I'm going to do, I'm just going to place my hands here and push it back, yeah? So that you get yourself aligned. Because if it rotates to the right, it will impinge on there. And if it stays for a very long time, you may have pain, because the muscles come from this particular vertebra and go over to the shoulder. So the shoulder, because of her fracture, maybe she has not been holding herself properly, and then of course it has been, affecting the neck area. Okay?
So when doing this kind of session, how many sessions is she supposed to come for it to be okay?
For her, I would probably just do 1 and 2 follow-up and see how her body responds. She doesn't have to come for ever. No. And of course, 1 or 2 sessions. And of course, you evaluate the person that you're working with. Younger people, shorter time. Older people might be longer sessions, because the body's ability to heal and to recover takes longer in an older person than a young person. So young people, maybe 1 or 2 sessions, and they're okay. But the most important thing is to evaluate what else they're doing, Make sure they're exercising properly, they're getting enough sleep, they're drinking enough water, and, they're watching the ergonomics of their workstation. Yeah, whatever they're doing, you just look at your lifestyle and make sure that your lifestyle is correct. And we advise. Our biggest thing about chiropractic and this center is advice from what you could do and how you could do it. So if you could turn around, my dear, let's have a feel of that.
So are these the basic tests that you guys do when someone steps here?
Yes, a whole range of motion, and the most important thing is to look at the lifestyle, what she does. So we're just going to motion, try this one and then this one. So here we go. I'm going to go this way. And we go. Just relax. That's good. Excellent. How did that feel?
It feels like there was a tightness, and then you feel some form of relief after you snap. But you can feel that snapping.
Right side. Let's have a feel of that. Yeah, and then left. And you can see her ranges, and then left.
Since you're dealing with the neck, Mohammed Haj is asking, at time I wake up, I'm feeling ache in my neck. What could it be?
It could be some way, the way you slept, maybe the pillows, different beds, how you sleep. Yeah, so it's very important to know how you rest. Yeah, so those are some of the things that we evaluate with our patients. We advise them on the type of pillows, how they sleep, and how they do that. Yeah.
I think now we have so many different types of pillows, the fibers, the memory foam, the orthopedic mattresses. Do they really work, especially the orthopedic ones?
Good question. And I know I'm going to be killed for this, but I always say that those are maybe gimmicks. All you need is a pillow that is the thickness from your ear to your shoulder. So you have to evaluate a pillow that you're taking. Don't spend too much time and money on pillows. most people have different necks. Some will have taller necks, longer necks, some will be shorter necks. So look at the length between your shoulder and your earlobe, and then say, okay, this is the right pillow for me, so that your neck is neutral when you're sleeping. You're not crunched up, or you're not, overextended. Yeah.
So you want to tell us these orthopedic mattresses, they're just marketing gimmicks?
Pink pillows. I did not say mattresses.
You see, we're also talking about the way a person sleeps.
Mattresses is a different thing altogether. I always say invest in a good mattress, because really this is a place that you're going to spend your life in. And make sure you flip your mattress over, because the mattress tend to get a little bit worn in an area. So every 3 months you're flipping your mattress over, flipping it, rotating it. But it's good to invest in a good mattress. Pillows, just look at your legs, your size, and your shoulder, and your neck, and the shoulder, the ear and the shoulder. All right? Yeah.
Ah, yeah.
I'll probably just advise on exercises. I'll send you over to the physical therapist who'll talk and work with you on exercises. Remember, you had tight hamstrings, yeah? What kind of exercises do you do?
Well, for now, nothing. I used to, but I think I work more than I exercise, which is not a good thing.
All right.
Yeah.
Yeah? How many hours at the desk, or are you more mobile?
I'm more mobile. I'm not on the desk. But I try to walk home,
Oh, yeah? Okay.
so at least I'm not
Yeah.
just lazing around
And drinking water?
and drinking water.
So Akbar, I have seen your question. You say you have a question too. Please ask. Moses Jeruna sama tuko tu sawa. Series Rotich na Gotea Albert, the someone who's noticed you. Dan K anauliza, my brother has a spinal injury which was caused by transverse myelitis. I don't know what that is. This caused paralysis and weakness on his lower limbs. I would like to know if you can help him to gain stability. So that's a question from Dan K.
Okay, Duncan, is it? Okay, all right. Transverse myelitis, yes. It's an infection of the spine, and it can cause paralysis. So I'd probably say he needs to do a very good rehab program for himself, and we have physical therapists who could help with that and help with his mobility as well, yes? Yeah. So the conditions that chiropractors per se may just advise through, or refer you to an expert who will be able to deal with you more, but there are others that we can deal with. So transverse myelitis, he needs to see a physical therapist and work with them through the process of getting stronger and gaining stability, depending on how bad and severe it is.
Churam Chapo, I don't know why you call yourself that, but thank you so much for watching. And William Otuor. Professor Carrion, what is the cost implication? And Karong H, how are you doing? Alicia, you are saying calling to Kohosi at place physiotherapy. Alicia pia anauliza, and why most of the time mgongo is too painful, too much. William Odora anauliza, I have a spinal spam problem. How can you guys help, and at how much?
Oh. Yeah, our consultation is 4,500. The first session you come in. Subsequent treatments are 4,000. Yes.
4,000 consultation, and then
4,500 for consultation, and then it's 4,000 for chiropractic care. Awesome. Yes. Consultation plus treatment. Yeah. Physical therapy is 3,500. Yes.
Okay. And Alicia was asking, and why most of the time mgongo yangu is too painful?
Yeah, Elisha, I'd look at what am I doing, with myself, that mgongo is too painful. And I always tell my clients that there's nothing like, oh, this is a normal backache. Backaches are not supposed to be normal backache. There's something that you're doing that is causing backache. So I'd probably advise, look at the things that you do and, reevaluate what you do and how you can do it differently. Yes.
Awesome. So, you're still doing something? Are you done?
She's just going over to physio.
Pardon?
She's going over to work with some stretches.
Oh, Albert. Oh, Albert is okay. Awesome. So, Albert, you're taking us through some stretches.
Okay. Yes. Okay. I've seen that she has a discrepancy, especially on her hips, towards the hamstring side. So I'd like you to lie down again so that I can do a reevaluation of what was going on. So simple. Just relax. Don't be apprehensive. If we can see the range of motion. Sometimes when you take this leg up, you find that you'll see from her face that sometimes she's a bit uncomfortable. And I'd like this particular area to be really straight, especially on the knee. in comparison to this other side, which was a bit problematic. You see, she's already bending her knee once I get to this particular level. That shows us that she has a lot of tightness to this particular muscle. This is the hamstring muscle. So I'll have to teach her on a lot of stretches just to work particularly on that hamstring muscle. And sometimes I have to do it manually for her so that I can get it right, so that I can make sure that the range of motion is perfect. So just relax. I'll try and go a bit high. You feel that stretch? Of course, I'll get towards the limit of pain around that area, and I'll hold for a few seconds. 1, 2, 3, 4, and 5. Relax. How was that?
You can feel that.
Yes, you can feel the pull from the back again. 1, 2, 3, 4, and 5. So what I always teach my clients, I always tell them, please continue doing some of these stretches just to help balance out the length of both muscles, because both muscles must be equal. If one is too tight, it's going to bring some discrepancy and therefore definitely causing a change in her walking or standing. So you might find that she might be standing but she's tilted towards one side, or the way she might be walking might be a bit different from the norm. So it's quite important for her to work on those particular muscles. And let's say, for example, if there are any exercises that she does, I'll have to see on her technique how she does those exercises. If she's doing them in the wrong way, I have to see on how I can educate her on how to do these exercises in the right way. So any exercises that you do, I heard you telling Daktari that you don't really do too much.
Yeah, I used to lift, but I've not done it for a while. So right now I have like it's like a restriction, like a resistant band that I usually use occasionally, let's say once a week when I have time. But that's more, it'll be like you just hook it onto your leg and you just like literally stretch. Yeah, you just stretch your body.
That's very, very helpful. So I'd like to encourage you to continue using it, though on the technique, I'll have you to come back again, and then I'm going to teach you on more techniques on how to do those stretches in the right way so that you do not strain yourself or hurt yourself, because this is something that's a slow process so that you can regain that muscle length and to reduce that tension. Okay, and sometimes I also add some modalities in terms of heat therapy just to relax those muscles so that they can get that tensile strength, so that they can be able to outstretch. Our muscles are so plastic, you know. If we leave them in a particular position for a long time, they become short or tight. Therefore, let's say, for example, when we expose ourselves to some positions, you find that we tend to have some cramps, and that one can be brought about by that kind of tension that has been building up on that particular muscle. Okay? Very good.
So that's it?
Yes, please.
If, let's say, like I was very physical and then I've taken a dip and decided I've become not as physical as my body is used to being,
yes.
Does that also end up causing pains because your body is used to being worked on?
Let's say, for example, it varies. If you are not working out at all, and then you go back to the let's say, intensive working out, you need to warm up so that at least you prepare the body for that kind of strenuous work. But if you don't, you tend to have some problems in terms of muscular aches, even injuries. You become more prone to injuries because your body is not yet ready for that kind of intensive exercise. So it's quite important to be warming up before doing those exercises. And even sometimes when you get back to exercises after a long time without working out, there is conditioning. You need to slowly condition your body towards gaining that form so that you can become better or improve your performance in whatever sport you're doing. Yes.
Any more question? Okay. I have a question from William Odor is asking, can you guys allow NHIF after you mentioned the price?
Oh, William, we don't take an HIF, but I'll tell you what, if you tell us that you had Pulse, we'll give a discount for you, that you saw us through this program, then we'll give you a discount because you're great. If you come in and quote Caro, then you'll be able to get a discount.
Msupanyams anauliza, what do you use for heat therapy after you mentioned it? Any home recipes?
For heat therapy, we use something called a hot pack. This is just like a bag of sand, or sometimes you can take bean bags. You can take beans and put it in a bag, and you can heat them up using some water, or even sometimes you can take some hot towels, boil them out, and then you put them on the body. But of course, you have to be very careful because you need to insulate it so that this heat isn't too much for the subject, because if I use too much heat on the subject, I might cause a burn. So we have to work within a lot of care. Another home remedy that one can use, a hot water bottle, can work very well, but you have to pad it very well so that it doesn't cause any burn on the patient. Yeah.
Awesome. Haya basi. Amesema I get you now. Amekupata vizuri. Okay, so what's happening on that end? Oh, you're looking at her hip? Yes. Aya basi. And of course, you're going to take us through people with condition like us. What to do in case of back pains and all of that. Mm-hmm.
Okay, for her, I'd like you to lie on your left-hand side, yeah? Because your hip was a little bit out. I'm going to bend your knee. That's it. That's good. And we're going to have your shoulder.
So when is the hip test done?
The hip test.
Okay.
All right. Actually, I saw it when she was lying down, and I meant to, but her major complaint was the shoulder, the neck. So I went for the shoulder and the neck, but her hip was a little bit that way. Okay. The way you see it is when you motion it, and when you look at it when she's lying down. One was a little bit higher than the other. Let me just...
So you want to say it's not the fat like amenona kidogo or something?
Good one.
Yeah, guys, did you know that if your hips are unbalanced, you have a problem?
No. I think she's been doing a little bit more dancing than usual. She's not telling us.
Oh, yeah. That I can agree.
On high heels, so you just want to bend this. We're going to hold here, and you're going to go...
Oh, Alicia anasema tuongezee volume. Maybe you can ongeza volume.
The other side. Let's see that.
Tuone kama hips moja ita reduce kidogo. I wish you took a photo of the before and after.
Just mobilizing her pelvic region. No, we're not going to reduce her hips. No.
Okay.
Excuse me, let me just position it.
So, William Odor, let me confirm the location. It's Lavington Green Mall.
Lavington Shopping Center, just above Barclays Bank.
Lavington Shopping Center, just above Barclays Bank. Aya basi, William Odor, I hope umesotika.
Actually, look at them and see how even. Actually, when she started, one was a little bit this way, but now she's, yeah. Okay.
Are you feeling any difference? Yeah. For real? Yeah. Okay.
Excellent. Okay. All right. You're done? No, we wanted to talk about you.
Oh, you wanted to talk about me? Alicia, yes, you want to say, yes, one must, if one is higher than the other one, just know you have an issue. And if your shoe, one of your shoe wears out faster than the other, just know that you also have a problem, right? Yes. And you need to get checked. I need to know that. So we are learning. So I should sit? What's happening now?
What's happening now? We're looking at Caro. Caro has a little baby bump, but it's nice. But the thing is, it doesn't stop her from getting checked, because we have some tables that you can actually accommodate the bump, so you can actually lower it or place it up. So Caro, I'd like you to sit and then roll over on your tummy. Just sit here first. Sitting, yeah. Sit, face, yeah, sit. Yeah, sit. No.
Oh,
sit facing this way. Yeah, and then roll over to your side first.
Oh,
lie down, yeah, and then head down in here, so that I want to demonstrate that your tummy can be face down. That's it. Lie on it. She's a bit scared. Lie on it. So yeah, thank you. All right. So yeah, okay, cool. Yeah. So for people who are expecting, for the girls who are expecting, you just can lie on your tummy. Lie on your tummy now, face down. Okay. Sorry, let's go this way. Yeah, that's it. All right. Does that? Yeah, and your hands are going to be here, and your head is going to be in here. I should have changed the face paper, but don't worry. So you see, it accommodates her belly. If you could move down a little bit further, that's it, and further. So this table can actually accommodate this belly, and then you can check her leg length. You can see what's happening with her. You can bend it and feel. You can rotate, and you can also palpate to see where the tension is. One of the things that I have that is very good for people expectant is a little tool here. It's called, oh yes, Car. It's called an activator.
Oh my
and
God.
it's just, it just moves the ball. It actually activates, stimulates the joint receptors, and you can put it there, and it just kind of moves the vertebra. You angle it in according to where you want it, and you can actually just work on it, just kind of opening up the spaces into the vertebra. So for Carol, if she had a problem, right now she doesn't, I'll probably just angulate it and place it there. Yeah? I know you want to feel it, so you can do it. Is that painful?
No, it's not painful.
It's not painful.
And I'll actually check her upper back, because most ladies, it's because of the strain here, you tend to hold yourself in a certain way, and it can actually feel that. And I'd actually use, if she's scared, I'd actually use this particular one. But because it's the upper back, I'd actually just use my hands, right? Okay, Carol, ready? All you need to do is take a deep breath in and out, okay? Okay, breathe in and out. That. Did you feel something moving? I'm not sure. I felt it. You didn't feel it too much, yeah? Yeah? Okay, and then I'll probably check her again just to see that everything has evened out very well. Okay? Excellent. So we'll have you coming out on the table, and again, just roll over to your side. Yeah, roll over to your side, and then you can sit up. That's it. That's it. So it's pretty easy for ladies who are expectant to actually come in for chiropractic if they have a problem with low back pain or something. Yeah.
So does that mean I'm super 100% fine?
You're 100% fine.
I'm fit.
You're fit.
For real?
Yes.
No, like for real.
For real.
See, jokes do we have cameras?
Oh, you're fit.
So I'm more fit than her.
If we have injuries, you can't.
She's real. It's the natural body, you know, the body is very intelligent, yeah? Yeah. Anything that's going on can actually sort itself out. Yeah. And pregnancy is one of the things. The beauty is about health, about wellness, about the body's creation. You know, this is one of the best way that we are very healthy. Yeah, so people who are pregnant should not have any issues with health, because the body's hormones are really stimulated and the body is working very well. The systems are really kicked on, and everything should be fine. Yeah, because they're trying to accommodate the new life that is forming inside them. So it's the best health. She's more healthy than any one of us.
They usually say sometimes if you go and get scanned and you see if your child hasn't, if your baby's breech, you can go to a chiropractor and they can reset it for you. Is that true?
That's true. There's a technique that we use it's called a Weber technique. Yeah, you have to be very well trained, but you have to make sure that the chiropractor that you're going to is certified in a Weber technique. You can actually turn the baby. They can manipulate and turn the baby. Yeah, excellent. That's
So
good.
it avoids you having to go through a CS if you catch it early.
If you catch it early, yes.
How early is that? How early are you guys talking about?
We're talking before the second semester. Yes, the trimester. Yeah.
You mean before you can already tell?
Yeah, you can tell, because when you go to your gynae, they'll actually be able to see whether the baby's breech or not. Yeah, and the earlier you do it, the more you can actually get it turning. Yes.
Okay. Now, for some of us who probably have back pains and all of that, what did you recommend for us to be doing, or probably a particular massage that you can get?
Yeah. For back pain in pregnancy, yeah, I'd be careful with the massages in pregnancy the first 3 months. Yeah, the first 3 months of the first semester, which we call the first trimester of pregnancy, so that you don't, get like Ali. Yeah. So you have to be careful for massage. But after that, you can do a soft massage on there to relax that. And then we have the taping that we now normally do. Did you talk to them about kinesiology tape? No. Yeah? Yeah? Yeah, you'll cover it. Yeah, yeah.
What did you call it?
Tape.
Pin.
Taping, yeah, kinesiology tape. You know the sports tape that most sports people wear? Yeah, it's right over here. Yeah. So this is a kinesiology tape, and what it does is lifts the skin off the fascia, and it gives the muscles a breathing space. So if you have tightness in an area, it's recommendable that you can get yourself taped on. And you find that sports people have this to protect them while they're playing sport as well. Yeah. And babies, pregnant mothers, you can actually tape the baby, so you feel like you're being supported. Yeah, yeah. It's a nice little technique on there to tape.
So do you do this every single day, the taping and all of that, Ama, for a particular period of time?
I forgot to tell you that this tape, you can stay with it for 7 days, and then you'll have to come back for retaping. But sometimes some people sell them, you can find them, and you can actually buy them and just, you can teach yourself, or you can come to us and we teach you how to tape yourself, yeah. So it's waterproof, you can shower, you can swim with it, you can do stuff with it. You actually don't feel like you're wearing anything, yeah. It's very good for helping, relieving pain and stress in the muscle.
Okay, so how much is this? The taping. Why are you laughing?
I like the fact that you want to know how much is this, how much is that. Tape, when you come in for a taping session, it's 500 if you don't have your own tape. If you have your tape, we can tape it for free. So just buy a tape in the stores. Most of the chemists carry them. And then come in and we can tape it for you for free. We don't charge for taping if you come with your own tape, but if you have to use ours, it's a 500 fee, yeah.
Since you're talking about taping, after delivery, instead of women using those things can they use the tape instead?
Use a tape, yeah. Instead of using the whole, belt, you can... The corset.
Yeah, the corsets.
Yeah. Tape has been a refined model of corsets. You don't need to have a whole big corset. You can actually be taped, and it's lighter and it's good. And we're actually taping groups of muscles. Yeah. Yeah.
See, we are learning, guys. So let me see whether guys have questions. In the meantime, I hope guys you have learned. Mi nimelearn vitu mingi. Kendi Labana anasema ati niko na wasiwasi sana. Oh my god. It's my first. Alisha anasema hata naona mtu yeye anacheza. Really guys, you're so Aya. If you have any question, feel free to ask. I think nimerenew sai. Naona tu zenye zimekupost tu sai sio za kitambo. But otherwise, I think we've really learned a lot and we really appreciate. Do you have anything else?
No, thank you.
Pardon? Oh, the contacts and all that, yeah.
Okay, all right. Laubot, would you like to say the contacts?
You're shy about Oh yeah. By the way, since you have a massage room over there, so of course, we'd like to ask, what are the dangers of going to the wrong massage parlor?
Massage parlors, if you have a serious issue, I would advise you don't go in for massage, but go in and see a physical therapist or a chiropractor, and they'll be able to sort you out. Massage is good for relaxation. Sometimes you have people going in with acute low back pain for massage, and they come back more inflamed, more in pain, because it's really not the solution at that particular time. Maybe you needed some other form of therapy rather than massage. Yes,
Msupa Nyams anauliza, is it risky to use sauna belts? I think she meant massage instead of manage.
Okay, sauna belts. What is that? Is that something that's hot and heating? Yes. I think I've seen it. It's okay to use a sauna belt, but make sure you don't use it for too long, because you feel the heat and it keeps the muscles warm. But don't use it too long, because the whole concept is to exercise and strengthen rather than support that particular area. Because most of the time, low back pain, if you're talking low back pain, is because we have very loose core muscles of the spine. The abdominal muscles are loose, and all you need to do is really strengthen those so that you don't have aches and pains on the back. And just know your lifting techniques. That's why I tell people that there's nothing like a normal low back pain. It's normal, no. No, there's something that you did that wasn't quite correct, or you have a weakness in the abdominal muscles, because the abdominal muscles are the ones that really hold our back. So we need to really check how we strengthen.
There's a lady asking a very funny question, Nyaguthi. My abdomen is too much. How can you help me in reducing it? Na bado anaendelea kuuliza ni kama nimeignore ati watu wana pot mna help aje kumaliza poti. Will answer?
I think first of all it depends on her diet. You also have to watch what you eat, because sometimes if you continue with your feeding habits, we become what we continuously do. So you have to cut down, watch on your diet, and you have to do some exercises, core stability exercises. As Daktari said, you find that the abdominals and the back work together like a natural body corset. So when you have a loose abdomen, you have back problems, and vice versa. So she needs to do a few exercises to work on the particular areas. That is especially the core, of which the exercises, if it's preferred, she can come. We can give more insight on that and how to help her do those exercises so that they don't cause any injury to the back or vice versa. Yeah.
Hapo mmejibiwa. Msumpanyams amesema asante sana kwa kumjibu about ya sauna. Alafu like okay, after a long day's work, and probably you need your hubby, your wife, your boyfriend, whatever to do you at least a massage. Could you probably at least give us a few pointers or something?
For me, I can say the kind of treatment that I do is not actually massage. It's physical therapy where we do soft tissue manipulation, and we are specially trained for that. So it's quite hard for your boyfriend or your girlfriend or your hubby to replicate what I do. So the only way that I can try and give pointers is if they can walk in and I'll see what I can do. Yes.
I mean, like you can probably say press here, do like this.
Yes.
Tufunze kidogo.
There's that type of massage that you find that you can learn from home, just how to work on those muscle knots, how to touch, but you find that what the physical therapist might do might be totally different from what the layman can do, or what the chiropractor does is not something that anyone can replicate. We are specifically trained for that. So it's not that I'm saying no, ningumu, but you can just do the soft ones. Those special ones, please let the professionals do their job.
Do the soft ones. To pay.
Yes, please. They can come, they pay for the first treatment, and then we'll see what they will see and pick from what we do. Well and good. Okay. Yes.
Guys, I've really tried. Nimejaribu kuulizia lakini haija come through. But anyway, we really thank you guys so much when you come to watch. Thank you so much. You already have the contacts now? Okay. So I read for them? Yes. Okay. So guys, to get in touch with Polycare, you just dial 0723 345 399. I repeat, 0723 345 399.
And
that's
we leave
it.
you guys with some brochures at least, so that at least you can see from them where you can contact us. We are at Lavington Green Shopping Center, just above Barclays Bank, and at Nyari South Estate. So this is with them. Please, you can contact us in case of any help you need. Yeah.
Sasa umekata sasa kutufanyia massage. Na I
don't do massage. I do something called soft tissue manipulation and some adjustments, not too many, but those ones are for the specialists. But for someone to learn something like this, maybe you go for a massage. But if you have a problem, please don't go to a massage therapist. Go and see a doctor, chiropractor, or a physical therapist. Those are people who are well trained to handle or diagnose these kind of problems. Let's say, for example, neck problems, muscular strains and aches, things like that. But just for strains, those simple ones, you can try the massage, the boyfriend, girlfriend massage. Those ones work very well. But in case maumivu yakizidi, muone daktari. Sawa sawa. And you guys know where to find us, so please, you're more than welcome.
Aya, asante sana. So guys, thank you so much. This was the What Poppin' show with your interest, Carolina Carls, and thank you so much. See you next time.